you can do it, we can help. My name is Janet Chupka, and I am a programs manager for HFA. I manage both the Blood Sisterhood and Fit Factor programs. Today's webinar is being presented as a joint effort between HFA's advocacy team and Blood Sisterhood program. And I want to thank you for taking the time out of your day to be with us. I would also like to acknowledge and thank Stephen Fitzmaurice, who is HFA's Communication and Advocacy Coordinator, for helping out and running the technical side of the webinar this afternoon. Before we get started, I just have a few webinar points and helpful hints. We do encourage and welcome your participation and questions. However, your audio will be muted by the system for the duration of the webinar, and this just helps to eliminate background noise that may disrupt the presentation. If you have a question, we encourage you to use the question box at the bottom section of your control panel. We will hold all these questions, though, until the end of the webinar and then pass them along to the appropriate speaker to be addressed and answered. Today's webinar is being recorded and will be posted to the HFA's YouTube channel in the next few days. So please feel free to go on there and rewatch the webinar and share the link with others as well. And finally, we would like to acknowledge CSL Behring and the CDC for their support of HFA and the Blood Sisterhood program. Our speaker for this afternoon's webinar will be myself and Katie Verb. So please allow me to introduce Katie to you. Katie was the former Blood Sisterhood coordinator and is currently the Associate Director of Advocacy and Government Relations for HFA. In today's webinar, Katie will guide you through the process of talking to your healthcare providers, family, friends, bosses, or even coworkers about what you are feeling and experiencing as a woman with a bleeding disorder and when is the right time to do so. She will also offer strategies for you to use in becoming a stronger advocate and communicator. Following Katie's presentation, I will be sharing a brief overview about HFA's Blood Sisterhood program and services, as well as a few other ways to get involved in the program. So let's go ahead and get started, and I'll turn it over to Katie, who will begin with the communication and advocacy portion. Katie?
Hi, Janet. Thank you very much. So this is a session very similar to one that we presented at Symposium, but we thought it was so important and the information was so important that we really wanted to give people the opportunity who couldn't come to St. Louis this year, the opportunity to get this information and to ask questions. So I'm excited to be giving this information out there, putting this information out there again, and let's get started. So what we are going to cover today are workplace disclosures and healthcare provider advocacy. I know that these are two big issues for women in the bleeding disorders community. When to disclose to your workplace that you might have a bleeding disorder, how to do so, reasons why, reasons not, etc. And then I know another big issue is really advocating for yourself to your provider that you either do have a bleeding disorder and getting the proper care. So we'll be covering both of those things today. So first, with workplace disclosures, one of the things that we want to put out there immediately is that there is no legal obligation to disclose or reveal a medical condition to an employer. If you feel when you start a new job or at your current job that you have no reason to, there's no legal obligation to. Another really, really important thing to remember is that any disclosure should be made after receiving a job. If you do choose to disclose, you should always disclose after you've received the job, after you've started, and when you're in the process of speaking with your employer about any accommodations or your regular workday. Should not be done before any kind of job offer. Another thing that's really important to remember is that any disclosure that you may have made should never interfere when applying for a new position within the same company. For example, if you have already disclosed your bleeding disorder to maybe your current boss and you want to switch positions, according to the Equal Employment Opportunity Commission, the new employer who you're applying under must treat you as a new applicant, and you therefore have all of the legal rights that come with that. For example, if again, all of the legal rights and no obligation to disclose. And again, any disclosure should be made after receiving the job to the new boss. And then again, the old boss is not allowed to tell the new boss any disclosures that you might have previously made. I do want to interject that on behalf of HFA, none of this is really intended to be legal advice. If you are having legal issues, we would really encourage you to contact an attorney. These are simply, we're trying to provide information to women so they can know where they stand, but again, not to be construed as legal advice. So the first thing when it comes to workplace disclosures is, why would you disclose? One of the things that is important to know, that if you think that you ever might need a workplace accommodation, for example, if you need to have frequent bathroom breaks, that might be considered something extraordinary. If you need to be have frequent visits to the hospital, frequent doctor visits, and missing days for that. If you need workplace accommodations, you have to disclose. So that's something to remember as well. And another thing that's really important too is that if you do, it makes your employer better able to respond in emergency situations. If you ever have an issue at work, it can be better if the people that are around you, if your close coworkers, if your employer know what's wrong and know what can possibly be wrong, so they can help you in emergency situations. So there's also, there was an interesting story about somebody with a bleeding disorder who had to miss a lot of work, and his employer, because he did not know that he had a bleeding disorder, just simply assumed he was missing work, assumed that he was kind of slacking off on the job, wasn't really interested in the work, and ended up firing him. And then afterwards he came and told him, and his employer, said, if you would have let us know, we would have 100% worked with you. We would have, given you these accommodations, etc. So it's something really important to think about when you're having these issues. It helps people not wonder why you're always out, or just keeps people informed. But I can understand it's a very sensitive issue for a lot of women, so it might not be something that you want to do. But these are just some things to think about. But again, disclosures are made after you have received the job. Some other things to think about, some reasons why I've heard that a lot of people, and women in particular, do not disclose, is they get a fear of discrimination and kind of a stigma surrounding a bleeding disorder. It's often really misunderstood. It also can really put you in that advocate position. You're constantly having to explain what's going on with you, and that can take away from you actually performing your duties and performing your job. And it just adds a different dynamic to the workplace. And again, if you have no legal duty to, a lot of people think, why would I bother? And then protect privacy. Obviously, this is this can be something that's very private, especially for women, and they simply might not want to. So that's another thing, another list of things you might want to think about if you're considering disclosing. Another thing to think about too is the type of workplace accommodation you might need. The most common accommodations that most employers can provide can be found at the Department of Labor Job Accommodation Network. If you can look that up, you can find the information about what accommodations can be made for you are pretty easy to find. So some more things to remember in regards to workplace disclosure. You may have certain protections under the Genetic Information Non-Discrimination Act. And this basically states in the simplest of forms that employers cannot make any employment decisions, hiring, firing, etc., based on genetic information. However, another thing to really to be conscious of is that confidentiality laws vary by state. So you have to really look at your state. And what I mean by confidentiality laws, whether or not if you have disclosed to one employer if they can tell references that call afterwards. You know, those are things that also if they, once you are, if you're confidentiality laws by state that surrounding each of those instances. So I would look up and try to do your due diligence by state what your protections are if you do decide to disclose. If you only would like your employer to know for reasonable accommodations, but you live in a state where he could tell everyone you work with, you really might want to think about that. If you think that you would only need accommodations in one job but you want to quit and maybe apply for another job and they don't have there's not laws protecting your confidentiality in the previous disclosure, that's another thing to think about. So when doing all of this, it's really important to do your due diligence, to look up laws, to look up your protections, and see how things are in your state. There's also a service called Advocating for Chronic Conditions, Entitlements, and Social Services. It's the Access program, and it's at Patient Services, Inc., and it provides legal support if you think that you've been discriminated against. That's another thing for you, another tool. So Patient Services, Inc. and the Access program is another tool for you to use if you believe that you've been discriminated against in your workforce and might not have the ability to hire an attorney immediately. So just another tool. So the next topic is healthcare provider advocacy. I know that a lot of women have had issues with this and have issues simply just receiving a diagnosis, which can be incredibly frustrating. I think that the most important thing when advocating to your provider is to keep careful data. It's to, especially if you're experiencing menorrhagia or if you're, experiencing longer than average menstrual cycles, it's really important to keep as careful track of that as possible, because when you go to see your clinician, it's much easier to say, look, I have everything documented, I have everything written down, I experienced these symptoms over, this long period of time, here's the evidence, as opposed to, I think I'm having really heavy cycles or, or it doesn't feel right. So just keeping that really careful data is so essential when you're talking to doctors. And remember, they're scientists. They understand the data. They understand that medical information. So I think learning what doctors need to know and then keeping that data is really important. Also understanding the strengths and weaknesses of your clinician. You might have a clinician who's a really strong OB but would not be a really strong hematologist, and so you might have to go to different people. You might have somebody who's a really strong advocate, which is always good, but just really knowing what your clinician's strengths and weaknesses are, whether or not they're good in one area or another. And again, you might have to go to different people for different things. Another important thing is knowing hospital resources. Knowing, also one of the things that's super important, and we found that a lot of community does not know is there an HTC at your hospital? We've found that a lot of people, they know that they go to a hospital, but they don't necessarily know if it's a hemophilia treatment center. So knowing that is also really important. Knowing what resources are available. Do they have a patient advocacy panel? A lot of hospitals have panels of patient advocates that you can go to. Is there an ombudsman? An ombudsman is a person that acts as an advocate for you in between you and a big organization. So universities often have them. Hospitals have them as well. So find out if if that's a tool, and then you can go to them and tell them your story. If you're having an issue getting treated at a hospital, having an issue getting treated with a certain clinician, find out if they have tools built in within the hospital. Either it's a patient advocacy panel, and I'm on ombudsman, or some type of tool that can help you speak with your doctor and really become an advocate. The other thing I wanted to talk about too is and part of the keeping careful data piece. HFA developed this bleeding disorders app for women, and it's one of the things that's really, really great about it is that you can see here in the second picture, this is actually called the pictorial bleeding assessment chart, and it is what doctors use when determining if you're experiencing menorrhagia. It's what doctors use to determine, heavy versus light. And then also you can see that at the bottom there's a have you experienced clots or no clots? These are the actual questions. HFA did a lot of research, spoke with a number of physicians, both OB-GYNs, hematologists, to find out what is the exact information that would help you diagnose a woman with a bleeding disorder. Again, not simply, I believe it's really heavy for a long period of time. These are the things. They have a whole list. So we built this into this app to help, it is in that keeping careful data piece. And again, this is the information that they need to know. So if you are using the app and you've plugged in, 4, heavy usages over, the course of one day and then one clot, that will tell them all of the information that they need to know. They can say, oh, okay, so this is not just a kind of a feeling, or, this is the actual usage, and this is what I need to know to diagnose bleeding disorders or diagnose menorrhagia or diagnose other issues. So the app will really help you keep very careful data. And then for women that also experience joint bleeds or possibly ovary bleeds or internal bleeds, you can also keep track of it. On the third screen in, you can see the woman, the beautiful woman there in the skeletal picture. You can track on there where you've experienced pain. So that's obviously another component for women with bleeding disorder. It's not simply menorrhagia. It's also going to be joint pain. It's going to be internal bleeding, and so you can track it there. So you can put together everything and go to your doctor and say, look, this is what's happening, and help advocate for you to your provider. So those are the two issues that we really wanted to go over. Some things to think about in workplace disclosure. Just to kind of wrap up my portion, if you believe you've been discriminated against, Patient Services, Inc., or PSI, has an access program that has attorneys that can discuss that with you. Do your due diligence for confidentiality rules in your state. Find out what employers can and cannot divulge based on information you've given them in an application or even in person. And then think about if you're ever going to need an accommodation, you have to disclose. There's that, and then again, all disclosures should be made after you've received a job, not before. So those are really the main takeaways from the workplace disclosure. And then as far as healthcare advocacy, the data, keeping careful data, keeping track of what's happening to you is the best way to work with your provider. It's putting everything in a language they can understand. And then if you have issues, use the resources that are available to you, either through your member organization or through the hospital that you work at. Look into various patient advocate groups that might be available to you there. Well, that's the end of my portion. Thank you very much, and I believe we'll be taking questions at the end.
Great. Thanks, Katie. That's really good information. Thank you for sharing it. So as the Blood Sisterhood Program Manager, I'm just going to share with you a little bit about the program and then what's happening with it and just a few ways that you can get involved. So In recent years, we're really hearing women with bleeding disorders and carriers speaking up. Women are now really coming forward and saying, you know, we're bleeders too, and we want to be recognized, we need support. HFA hears you, and we understand women with hemophilia and von Willebrand disease and symptomatic carriers of bleeding disorders face many challenges, such as unexpected bleeding episodes, lack of diagnosis, limited access to and difficulty obtaining necessary treatment. So we're really happy to support women through our National Blood Sisterhood program, and we serve women during all stages of their lives. The Blood Sisterhood program provides education and support. We promote good health and establish a sense of community for women through a variety of ways. Recently, we redesigned and updated our web portal. We do provide face-to-face educational and peer support meetings, both locally. We do that through our member organizations at their local events and meetings. And there have been many educational sessions that have been scheduled around the country at our local member organizations. So talk to your local organization and find out if there have been any women's sessions planned, and please take advantage of them if there are. And then also nationally at our annual symposium, next year's symposium will be held in Las Vegas, Nevada. So we do provide education for women at our symposium as well. And then we also offer education and support through webinars like this one and through our new mobile Sisterhood app that Katie just discussed in her portion of the presentation. Next slide, Katie. So in 2015, we've decided some areas of focus for the Blood Sisterhood program, and those include increasing regular physical activity and healthy nutrition practices for women. And we have a particular focus on joint health in the next couple of years. We're also working on educating women on ways to reduce stress in their lives, and then working to build a network of women who are strong advocates, not only for themselves and one another, but for the community as a whole. And lastly, we're kind of looking to increase the engagement of our younger community members, particularly those who are 18 to 35 years of age. So really want to engage them more in our program. So if you're new to the Blood Sisterhood program or just want to be kept up to date, I really encourage you to visit the Blood Sisterhood web portal. This portal provides information and resources about bleeding disorders. There's symptoms common to women with bleeding disorders. We have health and wellness information and links to other resources for women. We also have a collection of personal and really powerful stories from women who are sharing your experiences and living with a bleeding disorder. And most recently, we added a link to a brief survey. It's our Share Your Story survey, which you can see at the bottom right hand of your screen. And here, women can share with us about their experience in getting a diagnosis and treatment, and about the quality of care they received in doing so. Any information that we get about any denial of care from HTCs is being tracked, and we are actually reporting that information to HRSA. And we can do this to HRSA anonymously, so the woman does not have to be identified. But HRSA is receiving that information, and they have said they are following up on this and are providing retraining at these centers, which does include care of women. So we are trying to really help improve the quality of care for women with bleeding disorders, and we really need your voice and your story to make it happen. So please visit our website and click on that graphic and share your story, because it is making a difference. Next slide, Katie. And then I know Katie did go into detail about our Sisterhood app, but I wanted to mention it again because we're just really excited to bring you this tool. It is a free app, and it was totally designed and developed by HFA and specifically for women with bleeding disorders. It is available for both Apple and Android devices, so you can find it in the Apple Store if you have an iPhone, or in the Google Play Store for Android devices. And you know, Katie kind of went into depth about it, but if you would like more information on it, we do have a web page, and that's sisterhoodapp.com. So feel free to go there and visit and get some more information about our app. It's it's just a really cool tool, and we hope that you please download it and just take advantage of all the features that it contains. So again, I encourage you to visit the Blood Sisterhood page on the HFA website. There's a registration box where you can go on and register to become a program participant. And in doing so, you can choose to receive a nice little welcome kit. And you'll also be kept up to date on all that is happening in the Blood Sisterhood program and at HFA as a whole. So we are a growing program. We are gaining momentum. Lots of women are coming on board, and we would just love to have you be a part of it as well. So that is it for my part. Are there any questions about anything that either Katie or I covered today? If so, if you would go ahead and type your questions in the box at the bottom of your control panel. And while we were waiting to see if any questions come in, Katie, if you go to the next slide. We just want to, again, thank CSL Behring and the Centers for Disease Control for their support of HFA and the Blood Sisterhood program. And I personally would like to thank Katie for sharing her knowledge and expertise with us today. And thank you all for taking the time to log in and be here with us. Next slide, Katie. So we'll just wait another minute or two and see if there's any questions that come in. I'm not seeing any so far. So I'm not seeing any questions come in, so I guess we will wrap this up for today. But if you would like to find out any more about any of the information that either Katie or I talked about today, or for information about any of HFA's programs or services, please visit us at hemophiliafed.org, or you can contact any of us by email at either of the email addresses that are on your screen. So thank you so much again for joining us today, and we hope you enjoy the rest of your day. Thank you.